It is a great honor and privilege to welcome Swami Shankaradev Saraswati, an extraordinary scholar, healer and spiritual teacher whose life reflects a rare, inspiring synthesis of Western medical expertise and Eastern spiritual wisdom. A physician, psychotherapist, Jyotish astrologer and renowned yoga acharya, he has devoted himself to the service of human transformation since graduating in medicine in 1976 and embarking upon his spiritual journey through initiations into the yogic tradition. His profound understanding of yoga and tantra was cultivated during the transformative decade of study and practice at the Bihar School of Yoga, India. Through his unique ability to integrate clinical insights with timeless spiritual teachings, Swami Shankaradev offers a holistic perspective on healing and self-discovery. His personality radiates wisdom, compassion, humility, and deep spiritual maturity, inspiring countless individuals to bridge the gap between science and spirituality in the pursuit of health, balance, and higher consciousness. So, ladies and gentlemen, please put your hands together to welcome Swami Shankaradev.
Namaste, Swamiji. Pranam.
How are you?
Whole stage is yours and we are eager to listen. How does yoga therapy complement modern medicine? Stage is yours.
Thank you, Dr. Vikrant. Thank you for this invitation to talk on this wonderful topic. So, as the introduction so beautifully introduced me, I'm a Western medical doctor. I'm still practicing. I'm sort of on the edge of retirement. And it's hard to believe that I graduated from Sydney University 50 years ago, at the same time as I took initiation into sannyas. So it's been a journey of medicine and healing over that time. And I've been privileged to meet many great masters of different esoteric traditions who've been very generous in giving me, supporting my journey. And now I'm sort of pulling back from medical practice. I'm mainly focused on teaching and writing books. I teach and write about yoga therapy, philosophy and psychology on our website, Big Shakti, with my partner, Jane Stevenson. And we offer courses, workshops, meditations, and various consultations. And we're putting all of our courses into books. I'm presently writing a book on mantra yoga therapy, which I think has proven to be one of the most powerful forms of intervention in my own yoga psychotherapy practice. And I'd say our focus is really on yogic psychology or psychophysiology and the deeper dimensions of what we call yoga tantra, which is a complete system for mental health and self-development that complements and broadens the scope of what modern medicine can offer. So I think that the word yoga alone misses some of the vast knowledge contained within the Indian traditions that come out of the tantric traditions. So we think of yoga as yoga tantra, a combination of classical yoga, these 8 limbs that give us this beautiful understanding of the path, and the ancient systems of tantra, which in my opinion are the practices that we're predominantly using today. In the way that if you think that classical yoga in Patanjali focuses purely on consciousness, and the techniques in the Yoga Sutras are extremely difficult for anyone to master, whereas Tantra is a system that's much more appropriate to this day and age in terms of dealing with all the shadow elements that are going on in the world. And Tantra basically is defined as any system that awakens energy or activates energy to awaken consciousness. So I want to begin with a simple observation that has stayed with me for over 50 years, that everyone who comes to see me as a doctor or a therapist or to any yoga teacher is seeking the same thing. They all want to suffer less, they want to live more fully, and they want to understand why they are the way they are. What is the karma? What's going on inside them that's taken them to a certain point in their life where they need some therapeutic intervention. And it can be anywhere along the spectrum of healing, from people who are suffering from very severe illness through to people who are in that gray zone of just not fully feeling vital, to people who really want to keep promoting their health and approximating some kind of optimal health and state of being. Finding a possibility, what can we do to improve ourselves, to optimize our lives? And so Western medicine is extraordinary at telling us what's gone wrong in the body, and yoga tells us how to make things right, not just in the body, but in the whole human being. So these two systems are not in competition, and they're at their best when they flow together. And I've spent my life trying to stand at the confluence of these two systems, and I've found that the integration of yoga, tantra, and other esoteric traditions that have come out of the great wisdom traditions of India in particular, especially Sankhya, which is one of my favorite philosophies, has been profound in terms of my own personal life, my own well-being, physical, mental, and spiritual, but also for my patients and students. So modern medicine, we have these incredible tools, transplants, the sequencing of the genome. We've eliminated many diseases that killed millions just a century ago. And this is not a small thing. And I say this as someone who trained at Sydney University's medical school, and then when I was living in India, I practiced medicine as part of the Bihar School of Yoga as a NGO, going out into the field to support people. And in India, especially in many of the poorer parts where we were working, Western medicine is combined with sort of Ayurveda and other systems is incredibly powerful and important. But it's particularly, I guess, in the Western context that Western medicine has got this structural limitation that's now only beginning to address, that it was built around a disease model, around pathology and our attempt to neutralize pathology. And in so doing, it's tended to treat the person as a collection of symptoms or discrete systems that are managed by various specialist traditions. So, for example, it could be through psychology, pediatrics, immunology, surgery. All these different fields of medicine tend to look at the person as not as a whole being, but as these discrete parts. And where yoga comes in is that it helps us to build a kind of holistic understanding of who we are and how each of these different parts of us are interacting. When I say yoga, I want to be precise about what I mean, because in much of the healthcare world, yoga still means stretching on a mat. And while asana has real value, it represents only a small percentage of what the ancient wisdom traditions of India actually offer. And as I said before, one of my favorite philosophies is Sankhya, and it is the foundational philosophy of yoga. It is the theoretical basis of most of the Indian systems of philosophy, psychology, and healing. It's one of the world's oldest philosophical systems, and it gives us a complete map of the human body. It gives us a map of body, prana, mind, intellect, ego, psyche, and the deep consciousness that underlies all of them. So it's a powerful template that we can bring into any field. It's a universal template that can be applied anywhere. So it's within the Western medical tradition, it could be seen as a sophisticated model of human psychophysiology that predates any understanding of Western psychophysiology by millennia. And from this foundation, the yoga tradition has developed practical tools that directly address the various layers of human experience. Pranayama, the regulation of the breath and the pranic body, directly modulates the autonomic nervous system. Mantra therapy, the use of sound vibration, is a therapeutic tool that works at a level that Western neuroscience is only beginning to understand. There is some good research on mantra coming out in that repetitive auditory stimulation at specific frequencies can produce measurable changes in brainwave patterns, heart rate variability, and emotional regulation. And there are a variety of meditation techniques that range from deep relaxation, such as Yoga Nidra, which is one of the most popular meditations in the world today, to the powerful transformative techniques that come out of the Kundalini tradition, such as chakra meditation and mantras. That these address the deep unconscious patterns that drive so much of human suffering. And what Freud and Jung called the unconscious, yoga had mapped as the kosher system thousands of years earlier, as we heard in one of the previous talks on Vedanta. And the chakra system, often misunderstood in the West as merely symbolic, is in fact a precise model of how psychophysiological and energy systems concentrate at different anatomical and psychic centers in the body. And they work in what we call the subtle body, the underlying energy systems that we can access through various yoga tantra methods in order to activate and rebalance, in particular, elemental forces. And working with the chakra system is one of the most powerful ways that I found in my medical practice. For example, in yoga psychology or yoga psychotherapy, as I call it, working with the Agya chakra and the heart center through various methods is incredibly powerful and effective. And these are all sophisticated therapeutic technologies that can be used alongside and in direct coordination with modern clinical practice. In my own practice, the integration of yoga, tantra, and medicine operates on several levels simultaneously. At the diagnostic level, Western medicine tells me what's happening in the body, and the elemental diagnostic systems of Ayurveda and Sankhya provide us with a language for understanding their psychophysiological patterning, what's going on in this deeper layer, and which elements in the body and which organs of the mind are affected, and which yogic or tantric techniques to apply. At the therapeutic level, I'm not substituting yoga and tantra for medicine. If a patient comes with high blood pressure, they still have to take their medication, but they'll also learn yogic techniques that have been shown to reduce blood pressure, or at least to support some kind of amelioration, so the therapeutic process, the use of drugs and their medications can be simplified, which is a very useful thing in a practical setting. A person with depression still receives appropriate clinical support. If they're in acute crisis, they may need some kind of medication until some other process is able to come in and support them at a deeper level. So they're introduced to various practices that build energy, a feeling of strength and stability within the nervous system, and critically, a philosophical framework within which their suffering can become meaningful rather than seen as pathological. And this last point matters enormously, because one of the deepest failures of the purely biomedical model is that it offers no framework for meaning. It can tell you that you have elevated cortisol and disrupted sleep architecture, but it can't tell you why your life feels empty or what to do about it. And this is where philosophies, the Indian philosophies, are so powerful. They're incredible. And I always say the intellectual map of yoga comes quickly, but the territory takes a lifetime to walk. So the map, we get this map, but then we have to somehow apply it in a therapeutic and clinical setting. And this is something that takes time. And this is one of the problems around applying these systems within a yoga therapy framework, that we have to find a way of balancing the medical with the yoga therapy, so that that people feel that they have some tools to take away into their lives and they can feel proper change. There's one classical principle I want to emphasize that's sometimes overlooked, the principle of foundation before depth. This sort of leads on from that last point. In classical yoga texts and Western systems, there's this consistent insistence on building self-awareness, grounding, and a stable center from which to engage with oneself and the world. And this is very important. This is probably the most important thing that many of my patients take away, that they come back to a stable center from which they can operate. And once they have that self-awareness, that grounding, they then become much more cooperative and autonomous within the healing process. So I think that's my time, and I would like to thank you for this opportunity.
Thank you very much, Swami Shankaradev ji. And Swamiji, thank you very much that you mentioned that yoga therapy and modern medicine can complement each other. And you gave importance, as rightly you said, that modern medicine tells us what is going wrong, and yoga tells us how to make it right. And lots of practical tools you discussed, which are related to psychophysiological aspects, subtle body, nadi system, chakra system, pranayama, mantra therapy, and you rightly mentioned, because the goal of all goals of life is removing the suffering and establishing a happy life. Everybody wants it. And so these two things together can make a good tantra, as you define tantra, as any system that activates energy and rise in consciousness. We also loved your principle of foundation before death. I'm sure that the contributions that you have made will enrich our lives. Thank you very much.